talking to Joanna Fortune from Sulliv, who's a parent-child relationship expert. Joanna talked us through a number of techniques when I sat down talking to her. So today we're actually going to see how those techniques pay out. One of the most interesting ones for me, because I have a toddler, is the shopping list. So Joanna actually has the photos of all the different products here, and I'm sure James would be brilliant at this.
Yeah.
I do say so myself. So they get to tick off the shopping list, and they also get to recognise the products that they're buying as well. So that's our first one, which I love. And we're going to move on to the sand therapy, the sand tray.
So sand tray is a particular technique, and obviously there's a particular training that practitioners need to use it. But one of the overviews for people just to get an understanding of it is the tray has to be particular dimensions, so that when the child stands here, or an adult, we do this with adults as well, and with parents and children together, you can take in the whole tray without moving your head left to right, so that it's viewable that way. The inside of the tray is always painted blue, and you can see the end of the tray is as well. And this is to signify, be it water or sky on the inside, and you can make a pool or bridges or whatever it is you want to do. And the outside then is brown, which is that earthy earth colour. So we also then have a set of miniatures, and I have some of those out here just to give you an idea, that are all along archetypes, different things. You'd have people, home life, you have mythological creatures, you have elements of fire and light. But one of the themes that I think can be really interesting around understanding sand tray is how children use things like fences. So for example, you might have that child will put fences in and create basically a containment. Okay, so you can do it like this.
So do they feel trapped?
And well, the question in this would always be, is this containment to keep something in and safe, or to keep something out? And this will emerge in the narrative that goes with the play, so it's never the same.
So
for
would
two
you
different
give
children.
certain things depending on the child and what you're trying to get from the child now?
No, everything would be out, and they take a little basket and they will go around collecting things. The only real direction I might give is pay attention to the things that really draw you in, or the things that really repel or push you away, and pay attention to including those. The other things that can be very popular is to create the aspect of fire in the tray. We use these very easily sourced in any of your local Woodies battery operated tea lights, so they can sit and actually be a candle. But a lot of children will bury those in and just create the flame in that, so that then can become the fireplace around which a family sit, or it can become something that's a threat because it's fire. So it has that nurturance or threat aspect, and again you pay attention to the narrative of the child and the story they tell as to what it means to them.
How long would you give a child to work on this?
Oh, I mean, it could take their whole session. A session here typically would be about an hour. So some children will take the whole hour to do it, and very often will leave it there, which is their choice. We take a photo at the end so that if they do a number of trays, we can catalogue them.
And how old, or young should I say, can you start this with children?
A lot of people say, you know, it really should be done with children who are 5, 6, older. In here though, to be honest, we've done this very successfully with children as young as 3 or 4, because it's how they use it. They use it to tell, and sometimes with children that age, they might take the little characters they're using, and while older children might position them and tell you the story, younger children might, you know, and then they went over to the shop and they saw this fence, and they're telling the story with movement, which is why at the start you might take a photo of the tray before that begins, and then one at the end to show the degree of movement, and they get to create the tracks along the way as well, and that can become a part of their story. Around, but then, and they can bring in, you know, a threat might come in. You might have a very threatening animal come in, but you could see the tracks and follow them. So they get to do this, and then ultimately the two little protagonists here.
And that is pretty threatening.
Absolutely, and it's designed to be. But it teaches children. It's like that famous quote, you know, children don't need fairy tales to know that dragons exist. They already know that. They need them to know they can be beaten. And so in this, you've got your magic fence and you've got your fire. And so you can, the two little girls can win this out. And there's a mastery element to it. So that can be a really, really useful way. The other thing that can help children when I say pay attention to something you really don't like or really repels you is they might involve something like this, the cage, because the lid comes up, and you can actually take something. So I could take our little Grim Reaper here, and he's a bit scary. But if there's been a bereavement or if death is on my mind, I might want to include a representation of that in my story, but I find that very difficult. But I can include him.
Just put him away.
Keeping him in that prison there. So he's in the tray, but he's not actually a threat. So again, it's problem solving, it's teaching children about mastery.
So are you trying to find out the problem, or are you trying to solve the problem?
I think one of the things it's a bit of both, but I think one of the things that's quite unique with Sandtray is I, as a therapist, don't go looking for the information. I don't question it.
So as a therapist in general, you don't go looking for the information?
No, if it's there, I can use wondering, and I wonder what that might feel like, or I wonder, and using wondering allows children to go deeper into their play experience. I think with something like Sandtray, it's for the child to leave it here.
But why would someone come to you with their child? And, you know, why would...
Typical issues. I mean, typical issues would be any kind of behavioural challenges, any issues. There could be a transition or a real life experience. There may be a family illness, a new baby, a move of house, and the child is having some difficulties transitioning into that.
Would that move over into learning difficulties, school problems?
It can manifest in all of those ways, and it's very often, by the time it has manifested in something like regression, be it bedwetting, be it acting out or tantrum or fighting in school or refusing to go to school, any sudden changes in behaviour that cause a concern, that's really what we do. It can be around bullying, it can be around any of those experiences at all, and it can be something that's more serious, you know, living in a home with a child who has autism or Asperger's, and you might be the non-autistic sibling, and what's that like? So it can be around something that families are dealing with, be it sensory processing disorder, or, you know, one of those oppositional defiant disorders. So there's something else going on, and it's really around helping that child manage it, and the parents manage it as well.
Now, you touched on bullying there, which is it's a big topic of conversation in the moment, and it's also a big problem at the moment. I think it stems from children right through to adulthood, actually. Have you noticed a spike in people coming to you because of bullying?
Absolutely, and particularly even older children and teenagers, and what the effect that's having on their self-esteem. And even if it was something that happened them younger in school, in primary school, and they're now junior cert or transition year in secondary school, but they're still experiencing the effects. It has long-reaching consequences. And I suppose that's why it's so important to get help, and to say to parents that your job is to be your child's parent, but that's not the same as being their therapist. And there can be a value in some situations of having a neutral person come in, do a piece of work and disappear, and let you all get on with life and family life. Whereas if parents try and take on all of that role, your child may end up resenting you.
What advice can you give to parents out there at the moment who might be watching this and saying, I don't know if my child is being bullied, but I certainly know that something recently has gone wrong in school, or the behaviour has changed, or like you said, the bedwetting, or all the sorts of different things. Are there some signs, some sure signs that someone's being bullied, or...
Well, I think there are lots of signs. Really what you're watching for are sudden, unexplained changes in behaviour. And that's really when you go, okay, that's the symptom. I don't know yet what the problem is, but I know there's a problem. And then you start that process by sitting down with your child and saying, is everything okay? Is there anything I can help you with? No, everything's fine. I'm hearing that you're saying everything's fine, but my feeling, and own it, my feeling is that something is wrong because I've noticed that, and give one or two examples, and that makes me think that something is not okay. And if you tell me, then I can work with you to fix it. And if you're no, don't just leave it at that. Come back at it again. Pick your times when you're having that one-to-one time, that down time. Maybe strategically involve a book into your bedtime repertoire that deals with bullying or worries or anxieties. And there are lots of wonderful children's books out there. So stay away from the kind of commercialized stories of, you know, Disney princesses and that, because children know those stories. Be clever. Get your agenda and use books that deal with worries, and use that as your
actually get a list of those books to show people, which I'll put up on the website.
I can certainly provide you with a list for age groups and that as well. But then you get to have a discussion opening. Oh, I wonder how the little girl or the little boy in the book felt. What would you do if you felt like that? And you get a discussion going.
Or you might even evoke the feelings that they're having, and it might maybe get them
something like what we find here is when there's something that a child is really struggling to tell you or to say, allowing them the space to use a non-verbal technique like this can actually free them up. And really that's the aim of the intervention, not that I know, but that that child has released. So they get to do that by the degree of separation of making this the girl with the problem instead of me, or even involving animals or, you know, big people and little people, so that you can say this is the mom and this is the little girl. Some children prefer that extra degree and might use animals. They might have, you know, a big cow and a baby cow, and those are the protagonists, because that's that further degree of separation from me, but I can still play out my story. So this technique brings up anything that's there in the unconscious that is in there but can't find its way out verbally. Something like this can be really useful. Have
you ever had a situation where somebody just comes in, adult or child, and I'm very interested in adults using this too actually, that really don't know what to do or where to start? Really? Frequently.
Particularly older. I mean, children are great at going, wow, you've all these little things. And
because I can imagine an adult may come in and go, oh, I don't know, because I don't know, are you more inhibited as an adult? Of course. I think when you're specifically under the age of 7, your inhibitions are much, much less, because you'll just give it a go. You'll put it out there. And also you're very much in the realm of your narrative, imaginative play. So this is very much how you communicate and what you do. It's natural. Adults immediately go, well, I can't put that in because what will she think? Yeah, that's exactly what I was thinking.
And they're filtering
this represent?
But what has happened all the time with this is that sometimes people come in and they might go, I might do a sand tray, so I'll plan my story and I won't give anything away. But the way this is designed, you can't but give something away.
Has this kind of therapy been around for a long time?
Oh, absolutely long time. It's tried, tested. There's a huge amount of scientific theory behind it. The work of Carl Jung, Margaret Lowenfeld. There's a lot written about it as well. And I suppose it's evolved. The only where it has evolved, that it would have started off as a mosaicing system where you took coloured shapes and you used those to build a picture, and that was your story. And then it became about the sand. And I suppose the added aspect of the sand is the sensory quality that brings, and that in itself, when we think back as children, sensory play is one of the first stages of play that we go through. It does tap into what's there and what's really lying there. So we'll also have some children and adults who'll use water and they'll wet the sand, and that way you can mould it and shape it as well.
Would you give that option before?
There would be water sitting beside it. I don't even really say it, it's just there. And frequently, you know, people will do more than one tray. They may do a sequence of trays. They might do one every single week. They might do one and then never go near it again.
Never want to,
and there's no pressure. This is something that's on offer here. And then there are some people who only come for this. They come for
so they do find it really therapeutic.
Absolutely. And you know, the role of the therapist is that I might have a particular sheet and I can map, sketching what goes in and what order and where, so that if they move, I have the original map in place as well.
Would this be used quite a lot in Ireland, or is it quite specialised still?
Now, it's specialised in that you have to be trained to do it and to use it, but there would be a number of practitioners using it. A lot of play therapists will use it, and a lot of child psychotherapists will use it. And then you might have fewer now in Ireland, but some individuals who only use it. They are sand tray therapists, and that's how they work. We offer it here as part of our therapeutic services, because it isn't a case of here's how we do it, now make your problem fit our system. It has to be about what have we got that's going to help you and meet you where you're at.
And this brings us back to the adaptive parenting of one size fits all, which is not what you agree with.
Not at all. I don't even agree with it in therapy. You know, it has to be what you need. And not every therapist will have that, and that's okay. You just go until you find the one who is the right fit for you.
That's great. Thanks a million, Joanna.
Okay.